Breast carcinoma. It is common in female and rare in male. It is of two types. It arises from the ducts, which is called as milk duct, and the lobules, that is the glands producing the milk. It is further divided into ductal carcinoma, invasive and non-invasive, lobular carcinoma, invasive and non-invasive. Etiology is the age factor, usually after 40 years and near menopause, but it may occur at puberty due to multiple sex partners pinching, scratching, and pressing the breast rashly, accidental trauma to the chest, excessive use of alcohol, familial predisposition to breast carcinoma, hormonal management and therapy, obesity, and the history of chemotherapy for other pathology in the body. Stages of carcinoma. First stage is called as carcinoma in situ. The cancer cells are limited or localized in the inner layer of the ducts and the lobules, and they are still limited one. Second stage, when the tissue of the cancer cells has invaded the surrounding connective tissues. Third stage, when it has passed up to the chest wall and invaded and involved the overlying the skin of the chest. Final stage is metastatic one, when the cancer cells have invaded the axillary and supraclavicular lymph node groups and the other distant organs like lungs, liver, brain, and bones. Symptoms of the carcinoma. There is lump in the breast, maybe unilateral or bilateral one. There is dimples in the breast, discoloration of the skin and areola, discharge of the abnormal secretion from the nipple of the breast. Diagnosis. Simple self palpation of the breast tissue to detect the lump and the tenderness or the painful mass in the breast. Next is the MRI, in which the detailed study of the tissues, their size, their location is obtained. Mammogram, this is also the X-rays of the breast tissues, in which we can depict and also localize the tissue, cancerous tissue in the breast. Ultrasound therapy, also ultrasound can be utilized to detect the fluid in the breast one, especially in the ducts and the lobules. Treatment. The treatment, medical treatment is, that is classical treatment, chemotherapy, radiotherapy, and surgery. Chemotherapy consists of targeted therapy, immunotherapy. Radiotherapy is used for the eradication of the tissue after the process of the surgery to kill the remaining cells. It is from external source, and while it can also be used through the device and is implanted in and around the carcinoma or neoplastic tissue. the radioactive material is inserted. Now, if the cancer is ER, PR positive, hormonotherapy can be beneficial. But in triple negative carcinoma, when ER, PR, and HER2 is negative, it is very aggressive, very fatal, very progressive, and has poor prognosis. It needs immediate and fast treatment and the steps to be taken to eradicate the cancer cells.